I've had any success in my job, it's partially due to my membership in AHP.
Regardless of whether or not someone's been in the profession for 5 minutes or 30 years, whether they're at the top of their institution or they're an entry-level gift officer, there's something to learn from everybody.
So that's one of the best parts about what we do in our profession. We share everything we know and we stand by them to support, mentor, encourage, and ultimately achieve more effective philanthropy.
I can't imagine not having a trade association that you can rely on to get your questions answered. So AHP has been a really great resource for us.
We know healthcare is undergoing tumultuous change, a transformation unlike anything we've ever seen before. Cuts in healthcare reimbursements, changes as hospitals go from being paid for volume to being paid for value. This has made financial issues an up-at-night issue for leaders everywhere. Moody's Investors Service says a hospital needs a 5% operating margin just to keep pace with basic updates. Yet the median hospital operating margin hovers around 2%. Globally, healthcare is in a similar state. Despite some recent stabilization in bond ratings, accessing money for reinvestment and progress remains an immense challenge. Without the ability to earn it or borrow it, where will the answer come from? Many organizations are now realizing the answer is philanthropy. For the first time ever, major professional associations for CEOs and boards are putting a real focus on philanthropy as a strategic financial lever to power our progress. What does this mean to us? Our time is now. It is time to reposition philanthropy as a key revenue resource. It is time to show executives the importance of professionalism and knowledge among development officers. It is time to show we indeed have the solutions to enable change and to provide resources that will be a catalyst to care transformation. And it is time for us to be understood as an emerging priority, embraced alongside peers in our healthcare organizations. To ensure you have the knowledge and tools you need to navigate this new environment and to succeed, AHP is stepping up. We are evolving through progressive thought leadership, providing new tools, a new strategic direction, a new re-inspired AHP. Now, when the need for you, our members, is greatest.
One of the things that's been the most valuable for me in my professional development with AHP, and it's also probably my favorite thing about AHP, is that it brings together development professionals not only from diverse geography, but also from different sized institutions, academics, non-academics, systems, small institutions, urban, rural, and it's a great mix of people. It's easy to forget in our profession, and for those of us who have the privilege of working at large institutions and leading philanthropy at large institutions, is that there's something to learn from everyone. Every time I'm at an AHP conference or I have any interaction around AHP, I realize that regardless of whether or not someone's been in the profession for 5 minutes or 30 years, whether they're at the top of their institution or they're an entry-level gift officer, there's something to learn from everybody. I just want to thank everyone for all they do for AHP. I want to thank AHP as an organization, its board leadership, and the people who have stewarded and led this organization over the years, and for helping so many people do such great work in the world of healthcare philanthropy, which of course in turn is helping the world.
Our staff they came back very excited and energized. They thought they knew a little bit, because the 3 people that we sent this year were a variety of level. One was brand new, one was mid-career, one was a senior career person that went. So we had all three. All 3 of them came back saying how excited they were about the experience and being able to work and meet colleagues from all over the United States and Canada and do projects together and really understand and take some time to really think about what do we do as an organization and how do we raise money, how do we generate interest in our respective organizations. And so it really gave them a sense of accomplishment, a sense of understanding, a real positive experience and recharged the batteries, I mean, for them. They came back raring to go and really appreciated the experience.
Put simply, AHP shaped my career. For me, the AHP is more than merely a body of knowledge. It's a web of networks and mentors that connect us all.
AHP is my association and a part of really who I am as a fundraiser. And it really is a benefit, I think, to when you're working in philanthropy that relates to healthcare to become a member. A part of the mentoring that happens, working with individuals who are up against the same challenges, obviously understanding and learning from one another. These are all really the most important parts of AHP for me. I'm proud to be a member, and I would encourage all fundraisers who are working in healthcare philanthropy to join AHP. It really will make a difference, both in your shop and in your career.